The I-131 radioactive iodine is the best option when possible. Now, I also realize not everyone can afford it because it is pretty dang expensive up front. But you need to know why it's the best option, and maybe it's worth trying to find a way, which I realize all too well, sometimes there's not. But there are also questions about how to pick a good 131 clinic. Because even though it's a very simple procedure, the clinics are very, very different. Now, the I-131 is a tiny amount of radioactive iodine, and most often it's just given as an injection under the scruff, sometimes in pill form. Neither one is really better than the other, so don't worry about which one the clinic does. The reason it is so danged effective is because feline hyperthyroidism, unlike hyperthyroidism in humans, is almost always caused by a benign tumor. For situations when it's not a tumor, check out my video on a borderline diagnosis. Now, this tumor also forces the pituitary gland to stop producing TSH, thyroid stimulating hormone, which is what tells the thyroid to produce more or less T4. And the tumor shuts that off, which causes the healthy thyroid to go into a dormant state. And that means only the tumor is awake to take up the 131. So the tumor is a bit of a bully, and because of that, it becomes the target of the 131. I think it's so elegant because it turns its own nature into a cure. And that's the thing. It is a cure. Medication can control the T4. It does not eliminate or stop the growth of the tumor. And if there are tumor cells outside of the thyroid, what's called ectopic tissue, those are also destroyed. And with surgery, that's simply not possible. The 131 is much more precisely targeted than surgery. And the healthy thyroid sleeps through it all, and while the tumor is destroyed, the healthy thyroid is essentially untouched. And then it can wake up and start doing its job. Now, it still remains a question of whether or not there is enough healthy thyroid tissue left to do the job. There is the possibility that a cat will become permanently hypothyroid after this treatment, but that can be dealt with, and it is much better than having a tumor. I will talk about the post-131 issues and how to proceed in a separate video when I get a chance. Now, picking a good 131 clinic. Obviously, one of the questions is cost. But when they give you a quote, ask them what tests are required that aren't included in the quote. Because pretty much everybody is going to require a blood test. But others will also require x-rays and potentially even an ultrasound. So the difference between the quote and the cost can be significant. You need to know for sure before you pick a clinic. Also, how is the dose tailored? Much like the medication, getting the dose of 131 right matters. It used to be fairly standard to give every cat the same amount regardless of the estimated size of the tumor or how high the T4 was. And they were giving 4 to 5 MCI for every cat, and that is a high dose. It pretty much guaranteed that unless it was a malignant tumor, you were going to get rid of the tumor. But you were also going to get rid of some healthy thyroid tissue. It was a sledgehammer approach. It was not a good idea. And there are still some clinics that do it that way. So if they tell you all cats get the same dose, find a different clinic. How well they tailor the dose varies. How much that matters depends on the cat. And you can't necessarily, if it's just a difference of tailoring it well or tailoring it better, and to get better you have to drive an extra 2, 3, 4 hours, might not be worth it. But again, you need to have that information before you make up your mind. And I've got a cat who wants in the video. And this is Ariel, and she is our current hyperthyroid kitty. The third that we've had in the family. It's a tradition. Also ask, how long is the average stay? In the U.S., the average now is 3 to 5 days. You will still find places that do 7 to 10 days, a very few that still do 14 days. And that's frequently university clinics who you would expect to be the most advanced and up to date, but many of them are actually the furthest behind on procedures and protocols. In the UK, 10 to 14 days is still pretty common. There are a few clinics that have gone through the process to shorten the length of stay. Ask what the housing is like. Some clinics still just have the fairly small cages, much like in a regular vet's office. There's not even enough room for a full-size litter pan. If that's what they're like, I consider that a very bad sign overall. If they really cared about the cats the way we do, they would have better housing. Some have multi-room condos, windows, entertainment, and some have cameras so you can watch from home. Now, you don't necessarily need all of that, but you do want a fairly spacious housing where the food and water is not sitting right beside the litter pan. Ask them if you will be allowed to bring the food they're currently eating. It may or may not be a big deal. That's between you and the cat. But some places will allow you to bring that food or a toy or a t-shirt, something from home with your scent on it, which you will not get back because of the radiation issue, but it might or might not make the cat feel better, but it probably makes you feel better if you're doing something that makes you feel like you're taking care of them as best you can. And ask, if the cat has asthma, IBD, something like that. Some clinics won't do the procedure with those cats. You need to find that out ahead of time. But ask if they will give necessary medications. Some clinics are just terrified about the radiation issues and will not have any more contact with the cat than is the absolute minimum. As in, changing the food and water litter pan once or twice a day. Others will do whatever is needed. And you need to have an idea of what the clinic will or won't do. Now, you do have to keep in mind that you'll be talking to office staff, sometimes a vet tech, but generally speaking, you won't have any contact with the vet doing the procedure until you actually take the cat to the clinic. Maybe not then, it varies. Office staff will be telling you whatever they've been told. Sometimes office staff is very good, sometimes they're not. Don't judge the clinic entirely by the office staff. And I know you don't have much else to go on, but if you get a rude office person or one who doesn't seem to know what they're doing, keep in mind that they're not actually the ones who will be taking care of the cat. One other thing as far as the finances, by reducing the number of vet visits, the medication, and a number of other things, you actually do recover the cost of the 131 in about 2 years. So even financially, it is the best option if you can afford the upfront cost. It can be worth it if you can get something like care credit with a year or more interest free, but you got to get that son of a gun paid off before the free period runs out or you are up to your neck in interest. Now, there is the question of whether or not a cat is a good candidate for the 131. In most cases, yes. And it is not directly related to age. So don't just say cat is too old. And certainly don't say that for a 14, 15-year-old cat. When it comes to hyperthyroidism, that's not old. And cats older than 20 have successfully gotten the 131. Your regular vet, even if they are an excellent cat vet, is also not the best judge for whether or not the cat is a candidate. So listen to what they say, but contact a 131 clinic to get their input. A good 131 clinic. And you may get different answers from different clinics. The primary issues are kidney health and heart health. And kidneys, stage 2 kidney disease does not prevent doing the 131. Even stage 3, if you follow the right protocols, does not prevent the 131. It raises questions of whether or not it's the best option. But if a cat is allergic to the medication, won't eat the YD, then you can still do the 131 at the right clinic. You will also, you may or may not be asked to do a trial period on the medication before doing the 131, and that is to find out the true condition of the kidneys, since a high or low T4 can disguise the health of the kidneys because it plays games with the creatinine levels. However, it is more and more common to go straight to the 131 if the kidneys don't look bad. I mean, if you've got low normal or below normal creatinine, odds are the kidneys are fine. Even when the T4 comes down, if the creatinine goes up a bit, you're still in normal range. Healthy kidneys. But again, you may have to do a trial first. It is not critical in most cases. If creatinine is getting into mid-normal or high normal range, you probably should do a trial just to know what protocols to follow. And protocols to protect the kidneys essentially means using something like levothyroxine, a thyroid hormone, to make sure that the T4 doesn't go too low after the 131, because hypothyroidism is hard on the kidneys. Healthy kidneys can ride through the transitional period with no problem. If there's kidney disease, it can cause acute kidney problems. So in those cases, you make sure the T4 doesn't go too low, and eventually you get off the thyroxine and find out what the T4 really is. And again, I'll cover the post 131 procedures in a different video. It's common for there to be a heart murmur with hyperthyroidism. That does not prevent doing the 131. Your vet might say it does. Talk to the clinic. But most cats can get the 131 if it's done at a clinic that tailors the dose and is familiar with protocols to protect the kidneys if necessary. Or as long as you have somebody who does have an idea about the protocols, whether that's the 131 clinic, your regular vet, or online sources that are well experienced, even if they are not formally trained. So, if you got the money, if the cat is healthy enough, you do the 131 if you can get to a good clinic. Now, once again, I'm supposed to be paying attention to Ariel, and I forgot to record this when I was doing the rest of the video. I'm just kind of slipping it in. Hope it's not too confusing. And now back to the regular part of the video. But it is a cure. It is a fairly simple procedure. And the cat spends most of its time just hanging out. So if the housing is good, and if the people at the clinic are good, if they love cats, it's not that hard on the cat. It'll be hard on you. You'll feel guilty every day they're gone. But get the right clinic, and sometimes we call it a trip to the spa instead of medical treatment. A little easier to think of it that way. Well, I'm sure I haven't answered all of your questions. Hopefully I've answered a few of them. I hope you will click the thumbs up, subscribe, and make comments, share the video and the channel with your friends. And I think I'm going to have to be paying a little more attention to Ariel. So I will do the video about the post-131 treatment. I'll get that up hopefully this week. And we'll go from there. Good luck.